Today in our neck lift series, we're going to talk about platysmal bands. So platysmal bands are the vertical bands that we see on our neck here. Some people think it's excess skin, but actually it's the inside edge of a muscle. So what is the platysma muscle? The platysma muscle goes from above our jawbone, like drapes. It runs all the way down our neck, down to our collarbone on either side of our face. And when we're young, it's up pretty high and tight and pretty much connected in the center of our neck, making one tight hammock in this area. But as we age, that muscle starts separating apart, the inside edges get weak, and the inside edges show up as bands running down our neck. So that's why you'll hear about a platysmaplasty, is a surgery to fix and suture back those platysmal bands. But there's very different ways of doing that. So we make a little incision under the chin here in our neck lift. We lift up the skin. We find those platysmal bands. A lot of surgeons will just take them and stitch them together, but that makes it very likely for them to fall back apart. So we make it more successful by lifting the muscle up from underneath, getting them so that they're not tight, so they can come to the center a little easier, trimming off the excess muscle if there's excess, and then tying them together with specific sutures called figure-of-8 sutures that really hold that muscle together well. Now, sometimes despite everything we do, those bands want to pull back apart. But we've really evolved our technique for those sutures to be as strong as possible to reduce the risk of those bands falling back apart. Even with that, though, there is still a chance that no matter what we do, those bands sometimes don't hold and they come back. And sometimes we have to do a revision to that area. But that's the idea of a platysmaplasty, is not just tie it together. You have to release the muscle, bring it to the midline, trim the excess conservatively, tie it together with a good technique. That's what fixes the hammock back into the proper structure.